Good morning, everyone. I hope you can hear me and that it is clear. Happy International Women's Day, and thank you so much for choosing to celebrate with us on this momentous day. So most of our conversation today will be in English. We have simultaneous interpretation from English to French. You have at the bottom left-hand corner of your screen where it says floor, the option to choose language, and you can choose which language you'd like to follow the discussion. La conversation.
Today's conversation is mainly going to be in English, but we've got simultaneous interpretation towards French and English. At the bottom left of the screen where it says floor, you can choose the language of your choice.
Videoing and recording this event, so we will be posting it on our YouTube channel afterwards. So first of all, I would like to introduce to you the International Development Research Center's Vice President, Dominique Charron. She's the Vice President of Programs and Partnerships, and Dominique is going to be giving us some opening remarks. Over to you, Dominique.
Merci, Erin. Can you hear me? Yes, great. Good morning, good afternoon, good evening, everyone, and happy International Women's Day. It's my pleasure to welcome you all today to this event to celebrate International Women's Day with this panel on coronavirus, COVID-19, and childcare and its impact in and the situation in the low and middle income countries. Je vous adresse la parole de la ville d'Ottawa, qui se situe sur le territoire traditionnel du peuple algonquin.
To you near Ottawa in Canada. Because we're celebrating International Women's Day today, we have to acknowledge the contribution of autochthonous women and to think about the hardships they had to face and they are still facing today. International Women's Day is a global event to celebrate achievements at different levels, social, scientific, and we need to push forward towards equality.
Leadership, achieving an equal future in a COVID-19 world. The theme celebrates certainly the tremendous contributions that women have made to fighting the pandemic and the disproportionate burden of direct and, well, not celebrating the disproportionate burden, but recognizing the disproportionate burden of direct and indirect impacts of the pandemic that's shouldered by women and girls around the world. For example, job losses. Unlike other modern recessions, the pandemic recession has led to nearly twice as many job losses among women than among men. An estimated 740 million women are employed in the informal economy worldwide, and in developing nations, this work constitutes more than 2/3 of female employment. And as countries all over the world locked down, these jobs quickly disappeared. And this has had a catastrophic effect on women's livelihoods. And we note that women living in poverty and women from racialized and other minority groups bore a disproportionate impact. Violence is another area where women bear a disproportionate burden. Some 243 million women are thought to have experienced sexual or physical abuse at the hands of an intimate partner at some point over the last 12 months. This is more than the baseline level before the pandemic. Education is another area. Girls bear a disproportionate impact of the pandemic. By April 2020, last year, 194 countries instituted countrywide school closures, affecting 91% of enrolled learners, 1.6 billion children. There is a risk, still, that up to 20 million girls in developing regions may never return to the classroom because they have taken up household duties They are seeking to support household income, perhaps, through informal work, or they've had a child. The obstacles to return to school are much greater for them. And in science, women scientists already face significant job inequity and challenges in publishing and advancing their careers when compared to their male colleagues. And this is even more so in developing regions. And over the last year, we saw a precipitous drop in publications by women scientists for the same reasons. They are making choices, or not choices. They're choices they feel they cannot avoid to invest more time in the care economy. L'égalité des genres et l'autonomisation économique des femmes.
Equality is a very important principle in Canada. As you see, we are trying to put in place a policy to make sure that the commitments in favor of equality, gender equality, shows actions thanks to the research that has been made.
Of the COVID-19 crisis as healthcare workers and first responders, and have borne a disproportionate COVID-19 risk and physical and in terms of physical and mental health impact, and the impacts even more so among racialized women and women from other minority groups around the world. Throughout 2020, IDRC, along with many of our funding partners, invested in research to catalyze medical and public health innovations in response to COVID-19, and to mobilize data and evidence through research to inform the social and economic policy responses across all sectors. We also focused on bringing this innovation to bear on the education crisis that I mentioned earlier. And throughout, we focused on and were committed to addressing the structural and other gender inequalities and supporting measures for an inclusive recovery. The pandemic has undone years of progress, really, towards gender equality and many of the other sustainable development goals. IDRC has just launched our new 10-year strategy that recognizes that to have the greatest impact, gender and inclusion lens across all of our research programming is paramount, and the current context makes this doubly true. I'm pleased to announce today a new funding opportunity, the Gender in Science Research Initiative, that will be launched in the coming days. This initiative, cette initiative de recherche d'une valeur.
This research initiative about the value of about 8 million is going to promote women's career in the South and try to improve the integration of gender analysis in technology. Our event today is the official launch of the portfolio of empowerment, of women's empowerment.
The official launch of the GROW East Africa Research Portfolio, an initiative that is jointly funded by IDRC, the Bill and Melinda Gates Foundation, and the William and Flora Hewlett Foundation. GROW East Africa will spur transformative change to advance gender equality in the world of work, with a focus on addressing gender segregation in the labor market and reducing and redistributing unpaid care work. Today, we also feature the release of an evidence review on the global childcare crisis. The timing of this International Women's Day panel could not be better and worse at the same time. We are still in a crisis where women are bearing now a year's worth of impacts, and the road to climb out and to ensure an inclusive recovery is steep. We are committed to making sure that the research that IDRC funds contributes. J'aimerais remercier nos conférenciers.
I would like to thank our panelists.
Today's theme on childcare, the care economy, and the context that we're living with the pandemic. J'aimerais remercier Cheryl Urban, directrice générale du développement économique, Affaires mondiales.
To thank Cheryl, who is going to take part. Together, we'd like to put together all the different options, political options, and the possible solutions to create an all-inclusive future for these women and to contribute to a better future for all.
Together with the efforts of partners in low and middle income countries, will catalyze concrete steps towards the achievement of Sustainable Development Goal number 5 on gender equality and other sustainable development goals now and in a post-pandemic world. Thanks very much. Merci. Joyeuse journée.
Thanks a lot and happy Women's Day.
Erin? We seem to have lost our moderator. So there she is. Voila. Welcome back, Erin. Thanks very much. We can't hear you though.
Right.
Super. Thanks, Erin.
Thank
Over
you.
to you.
And thank you, Dominique. Thank you so much for those opening remarks. Merci beaucoup. I also realized that I didn't introduce myself. So my name is Erin Tansey, and I am the director of the Sustainable Inclusive Economies division at the IDRC in Ottawa. Yeah, so I would like to, first of all, after Dominique's remarks, just again, welcome our panelists. I'll tell you who they are, and then I'll just give you a bit of run of show for today. So first of all, we've got Kate Grantham. Kate is the founder and principal consultant at FemDev Consulting. She's the president of the Canadian Association for the Study of International Development and lead author of Evidence Review of the Global Childcare Crisis and the Road for Post-COVID-19 Recovery and Resilience. That's the paper that Dominique just mentioned. We also have Sabrina Habib. She's the co-founder and chief exploration officer at Kidogo Innovations, a social enterprise that provides childcare in Kenya. We have Kabiru. She's the director of the Population Dynamics and Reproductive Health Unit at the African Population and Health Research Center. And finally, Rudaba Nasir. She's the global lead for employment and childcare, gender and economic inclusion group at the IFC, the International Finance Corporation. So we're delighted also to have, as Dominique mentioned, our colleague from Global Affairs Canada, Cheryl Urban. She is the Director General of Economic Development and International Financial Institutions. She'll be delivering the closing remarks at the end. So the event is organized as a dialogue. We're going to have the conversation in two parts. The first part and the first round will look at focusing in on what is the situation, what is happening in the care, what is the care crisis at the moment, and how has it been exacerbated by the COVID-19 pandemic. And then afterwards, we will speak about solutions and get into some of the details there and some of the solutions that our panelists have been working on. So the moderated conversation will take about 40 minutes in total, and then we'll have about 20 to 25 minutes for questions. Thanks for those who've already sent in your questions by email. I just wanted to also invite you to, if you have questions when the panelists are speaking, to write your questions in the messaging piece. It's the button on the right hand of the screen. So you can just post your questions live. So we'll try to get to as many questions as we can, and then we'll have closing remarks from Cheryl Urban. But first, let's hear from our panelists, all of whom have extensive expertise and experience on the topic of unpaid care work. And they'll share their perspective on why it matters, why now, and what works to tackle it. So with that, we'll start off with a brief overview from Kate Grantham. So she's the lead author of this new report that sets the stage for our discussion. Kate, this report is timely, and it addresses an issue that women and families around the world are grappling with amidst the COVID-19 pandemic. The report stresses that the childcare crisis existed prior to COVID-19, of course, but it's now at a tipping point. It also stresses the urgency for action. So tell us a bit about the report and what led to this conclusion.
Well, thank you, Erin, and thank you to IDRC for inviting me to speak alongside such an amazing set of co-panelists on this day of International Women's Revolution. So we agree that our report is very timely and urgent. What we're seeing from the review of the global evidence and interviews with childcare experts is that COVID-19 is deepening pre-existing gender inequalities and norms around childcare, especially in low and middle income countries. So in our report, we've looked at 5 key pathways through which this is playing out at the level of household care dynamics, women's work and livelihoods, child education and early learning, the childcare sector, and the conditions of childcare workers. And as Dominique mentioned in the opening remarks, the shutdown of schools and childcare centers has resulted in a dramatic increase in the amount of childcare at the household level, and the burden is falling disproportionately on the shoulders of women. Women who were already performing up to 3 times more unpaid care work than men pre-pandemic. So women's time spent on childcare tasks has increased by 34% on average since the start of the pandemic. In most countries where data is available, women are now spending more than 30 hours per week exclusively on childcare, and that's nearly the equivalent of a full-time job. And while some studies have found that men are also taking on more unpaid care work and childcare due to COVID, in many contexts, not only are men failing to help out, but we're also seeing an increased level of domestic violence during lockdowns. In fact, the rise in violence against women and girls has been called a shadow pandemic by the World Health Organization. So adolescent girls who are out of school due to COVID are also being pulled into providing greater amounts of childcare for younger siblings. One study in 16 countries found that 64% of parents reported greater involvement of daughters in unpaid care due to COVID. This comes at the expense of girls' own time for studying, for remote learning, for leisure activities, just being girls. And a report by the Malala Fund has also raised concerns that 20 million girls may actually be at risk of never returning to school post-COVID due to rising poverty, premature entry into the labor force, and increased rates of early marriage and pregnancy. This was also the situation following the Ebola crisis in West Africa. Women are also being squeezed out of the labor force by COVID. ILO labor force surveys show a significant decline in employment in the second quarter of 2020 compared to the previous year, with a steeper decline for women than men in nearly all countries. This decline can be attributed to women leaving employment to care for children and to women being more likely to work in the sectors hardest hit by COVID. So for example, retail, food services. And women in informal employment with no paid leave, social protection, or job security are of course being the worst affected. And while some women may choose to leave the workforce temporarily with the intention of returning post-pandemic, research has shown that career breaks have long-term impacts on women's labor market prospects, and that women will return to lower paid and lower skilled positions. Finally, the global childcare sector, which is predominantly female, has also suffered significantly due to COVID. Childcare centers are seeing decreased demand and revenue as a result of lockdowns, while at the same time, their operating costs have increased exponentially in order to abide by COVID health and safety protocols. In many contexts, large numbers of childcare centers have actually already closed. And many childcare workers, including both center-based childcare workers and domestic workers providing care to private households, have either lost their jobs due to COVID or had their work hours significantly reduced. And those who continue to work are facing heavier workloads, difficulties commuting to workplaces during lockdowns, and limited protection from the virus. So what we're seeing is that there may actually be long-term consequences for the childcare sector and the availability of childcare services in many countries unless adequate support is introduced. So yes, the childcare crisis is at a tipping point. Yet so far, we haven't seen the mobilization of public and private resources that is so urgently needed to address this crisis head on. According to UN Women and UNDP, just 8% of global economic responses to COVID have addressed unpaid care, including childcare, and 2/3 of countries have enacted no measures whatsoever. And in low and middle income countries, governments and international financial institutions have largely failed to address unpaid care and childcare in COVID-19 fiscal stimulus and response packages. What we argue in the report is that this inaction cannot continue. Thank you.
Thank you, Kate. Thank you so much. I want to turn to you, Sabrina. So you run a social enterprise called Kidogo, whose mission is to improve the quality of early childhood care in East Africa's low-income communities. And this is one of the innovations that the GROW initiative will be studying for scaling up. So how has the pandemic impacted on the most marginalized women that you work with? What are you seeing on the ground?
Well, thanks so much for having me, Erin. And yeah, we're super excited to be collaborating on the GROW initiative with APHRC. So the pandemic, I wish I could give a more hopeful picture to Kate's remarks, but unfortunately we're seeing the same on the ground. The pandemic has been tough for everybody, and as Kate mentioned, has highlighted the extra burden placed on women and girls. One of the things we did as part of our COVID response was bi-weekly calls with the 4,000 plus families in our network just to check in. And we also launched an Ask a Childcare Expert hotline where families outside of the network could message us with concerns that they had or questions that they had. And between the two activities, we had a really good sense of the pulse of families, what was on their minds, and how that changed over the 9-month period last year of school closures. And here's what we saw. So let's start with mothers. Imagine being a mother of 2 or 3 children living in a 10 by 10 foot corrugated metal shack in an urban slum. And like 80% of the population, you work in the informal sector. You make your living by selling fruits and vegetables on the side of the road or washing clothes door to door, and you make a couple of dollars a day. And life is already tough for you, and then the pandemic hits. And in those early days of the pandemic, it's uncertainty, it's fear of the unknown that's really gripping you. But a couple of months into the pandemic, and you're not making as much money because no one has money to spend, and the top thing on your mind is, how do I feed my family? How do I feed my kids? Fast forward to July, August, one of the biggest concerns we saw, a surge in the questions that came in through the hotline, was about domestic abuse and child protection. Mothers would confide in us that their husbands were also very stressed and had taken up a drinking habit and would come home and take out their anger on them. And they would then take out their frustration on their children. And it was really disheartening to hear things like, I know I'm not supposed to, I know you've taught me about positive discipline, but I'm coming home, I'm exhausted, my child is making noise and I just hit them. And you could empathize with the mom. She was so stressed. And by September, October, 6 months into the pandemic, the major sentiment was, I'm mentally exhausted. I'm so tired. When will this COVID end? When will life get back to normal? And so I think that the overall overwhelming trend over the course of last year was there was such high maternal stress, and it kept building month after month until it hit a breaking point. And when you think about the impact on young children, their brains are developing whether there's a pandemic or not. And the research is so clear that in these moments of immense toxic stress, which is what our kids were going through, the best buffer against it is responsive caregiving. But if you're a mom that is just barely hanging on, you have no capacity to provide that patient, nurturing care. And I think the unfortunate reality is we won't truly see the impact, the full impact on young kids until they're a little bit older. So who stepped in to play that caregiving role while mothers were out hustling to figure out how to put food on the table? It was adolescent girls. We found that in our network, about 1/3 of our families had an older sibling who was over the age of 10, and it was the girls that took over the primary care responsibilities in the household. And we heard through our check-in calls that the very limited homework that was coming through primary and secondary schools through WhatsApp or printed handouts, it was the adolescent girls that had the most trouble finding the time to do those exercises compared to their male counterparts. And I think it would be really interesting to see that when schools opened in January this year, did boys and girls come back at the same point, or did girls regress because of this additional care responsibility that they had? And briefly on childcare workers, who are primarily female, they operate month to month based on childcare fees. And so when schools were closed last year, they had no enrollment because older siblings were looking after the younger ones. They had no income coming in, and so they closed down. And by the end of last year, about 60% of them had reopened, but only operating at 30% capacity. There's no data in Kenya to show how many daycares exist. It's a very unregulated space. But from what we've seen on the ground, our best estimate is that at least a quarter didn't open and have permanently shut down. At least a quarter. We think more, but conservatively, at least a quarter. And those that did reopen are struggling because parents can't afford to pay full fees anymore. If they used to pay 70 cents per day, they're now paying 50 cents per day. And so childcare workers have responded by taking even more children in order to make their ends meet. And these are leading to crazy caregiver to child ratios, upwards of 1 caregiver to 25 or 30 infants and toddlers, which is not helping childcare providers and is really awful for child development. So unfortunately, to sum up this grim picture, we've been working in this space for 7 years in the trenches, and I've never quite seen anything like this before. We are in a crisis moment. But I would also like to think of this as an opportunity and see what we can do and the conversations that we can have to have a better future for the childcare sector as we move forward post-COVID.
Thank you, Sabrina. Really interesting insights. Just incredible what's really happening on the ground. So I wanted to pick up on the point that the care crisis has important implications on women's role as income earners. Caroline, you were part of a GROW project that examined how the provision of center-based childcare impacts on the economic prospects of mothers in low-income settings. So can you tell us what you found and the relevance of that in the current COVID context?
Sure, and thanks very much for the opportunity. So as part of the Growth and Economic Opportunities for Women's program, the African Population and Health Research Center, together with McGill University, conducted a study between 2014 and 2017 to assess the effects of childcare support on women's labor force participation. Our research was informed by several strands of evidence, including one, according to the Kenya Demographic and Health Survey, nearly half of women who are between the ages of 15 and 49 years have a child who is younger than 5 years. So this situation is likely to be similar across many countries in sub-Saharan Africa. Now, for many of those women with young children, especially those in the lowest income brackets, as Kate mentioned, having an income-generating activity is a necessity rather than a choice. And in Korogosho, the informal settlement where we conducted our study, we found that working mothers contribute about 50% of household income. So they are having to balance childcare and work. Contrary to assumptions that many women in sub-Saharan Africa have many kin who can provide free childcare, our studies have actually shown that women have very limited kin support for childcare. For example, we found that in one study, nearly 1 out of every 5 women who are single in Korogosho did not receive any financial or child care support from any relative. So it's informed by that background that we designed a study that consisted of a randomized control trial that compared women who received vouchers for subsidized childcare in quality improved or regular daycares and a control group of women who received no voucher. We also conducted qualitative interviews and participatory research with women to understand the challenges that they face balancing childcare and work, and also to understand their views about our intervention and its effects. I'll speak to the findings from the randomized trial, hopefully in the next round. But in our qualitative interviews, mothers really emphasized the challenges that they face balancing childcare and work, and they underscored the need to work even if they didn't have anyone to take care of their child. And for many of those women, the choice either came down to take your child to work or leave your child at home. And both options, as Sabrina had mentioned about the types of jobs that they hold, had a significant risk, especially when they're speaking to the safety of children. So how might this study be relevant to COVID-19 and the childcare study crisis? Our study was performed well before the pandemic, but I think Sabrina and Kate have really highlighted a lot of the things that we would imagine would happen on the ground. And yes, there are some studies that have gone on and that I can briefly highlight. One, and it sort of mirrors what Kate spoke about. In mid-2020, the Population Council Office in Kenya conducted research in several informal slum settlements in Nairobi, and they found that women were twice as likely as men to take on unpaid domestic work, including childcare during the pandemic. I think Sabrina has talked quite a bit about some of the reasons for that. Now, about half of the women in that study reported that this increase in domestic work had a negative effect in their ability to work. And in fact, it does seem that the gap between men's and women's income increased during the pandemic. About half of women, compared to a third of men, reported that during the pandemic, they earned nothing. And this would be a situation that would be further exacerbated by the lack of kin who can support these women. But I think Sabrina and Kate have really highlighted some of the effects of the COVID-19 when we're talking about the care economy. Thanks.
Thank you, Caroline. Really interesting. I want to turn finally to Rudaba. So the IFC has done pioneer work on the role of the private sector and about the role of the private sector addressing women's unpaid care work. How has this crisis, the COVID crisis, impacted on the private sector? If you could tell us a little bit about that from your perspective.
Thank you, Erin, and thank you for the invitation today. It's wonderful to be here and celebrate International Women's Day with you all, and also talk about childcare and care more generally. As you mentioned, Erin, that IFC has done since about 2016 a lot of research as part of our Global Tackling Childcare initiative, which has support from the Government of Canada, to highlight the business case and good practices for employer-supported childcare and family-friendly policies, such as paid leave for mothers and fathers, flex work, breastfeeding, safe transport, etc., showing that in addition to governments and care providers, employers also have a very important role to play in supporting the care needs of their employees, especially in contexts where public provision may be limited or the fiscal space might be constricted. Employers can step in to ensure that their employees are happy, healthy, and productive along with their families. So I think, did a good job of establishing the business case, but we didn't just leave it there. We have been, since then, working very closely with governments, with client companies, World Bank, and other entities to facilitate the implementation, accelerate the implementation of these family-friendly policies and practices. Now, this work that we've been doing since 2016 has really gained significant momentum during COVID-19, as work from home modalities have adversely impacted employees' work-life integration, mental health and well-being, as well as engagement, productivity, and retention. And as many of my colleagues have pointed out today, this pandemic has had a particularly adverse impact on working mothers as they face an unprecedented increase in unpaid care and housework, which has threatened to reverse and in many contexts has already reversed decades of progress in gender equality in the workplace, as well as in the labor force. Now, the good part is that more and more companies, large and small, recognize that in order to achieve resilient and lasting recovery, business longevity, and employee productivity and retention during and post-COVID-19, it is imperative for them to support the care needs, mental health and well-being, as well as the work-life integration of their employees. For example, in Fiji, when our research showed a few years ago that private sector companies are losing 13 days per employee per year due to childcare related challenges, and this has increased during COVID-19. This prompted the government to take action, even during the pandemic. And they just signed a cooperation agreement with us last week to design the country's first early childhood care services policy and regulatory framework with active participation from the private sector. So as you can see that there's a lot of momentum, both from the private sector, both from the public sector. And I think there's a lot of room for public-private partnerships and action in this space to move forward.
Great, thanks, Rudaba. Some very interesting insights into the role of the private sector, which without them, I think we will really be things will move much more slowly. And it's interesting that you speak to the policies that can be adopted even quite quickly, even within a pandemic. So that's definitely something to look into more closely. So this is maybe a good segue to move over to the solutions side of our discussion. So I wanted to ask the panelists what can be done. So a quick reminder to use the chat for those of you in the audience that want to put in a question for one of our panelists. So let me go back to Kate and then start with her. So your report that's just out today has some specific recommendations, and it would be good, I think, for the audience to hear maybe some of the highlights from your report that you did in low and middle income countries. Maybe you can focus on the top 5 recommendations that the report seeks to convey.
Sure. Yes. So in our report, we do provide specific recommendations for policy measures that could be explored in different contexts by governments, the private sector, and other key development actors, with a focus on low and middle income countries. And this includes measures to recognize, reduce, and redistribute unpaid care work, reward paid care work by promoting more and decent work for care workers, and guarantee care workers representation with employers and the state. And these are based on the ILO's 5 R's of care framework. Mm-hmm. So while many of our recommendations are not new, they are more important than ever as countries recover from the pandemic. So in the interest of time, I'll share just some examples focusing on LMICs, but of course, I invite everyone to read the full report. So to start, women and girls' unequal burden of care must be recognized, reduced, and redistributed to men and to the state. Governments need to ramp up investment in gender-responsive public services. Families spend less time caring for children when they have access to affordable public services like piped water, sanitation, and electricity. And under COVID-19, long-standing calls from feminists and other groups for investment in these services have become even more urgent. So in West Africa, several governments have actually either subsidized or fully covered the cost of electricity and water bills for vulnerable and low-income households during COVID. And this is a very positive step. We'd like to see more of this. Governments and employers alike also have to support households in managing their increased childcare loads. So especially in LMICs, governments need to be introducing or expanding social assistance and other forms of social protection and prioritize single parent households, essential workers, and informal workers. And as Rudaba mentioned, and I'm sure she'll go into further, employers also have a responsibility and a role to play in adopting some of these family-friendly workplace arrangements and policies that she's already mentioned. So to address the root causes of women's and girls' unequal care burdens, governments and civil society organizations can actually take action to shift social norms around childcare. Research is showing that gender transformative workshops, media campaigns, and school-based curricula have all been shown to increase the involvement of men and boys in unpaid care work. Next, more and decent work for childcare workers. So to do so, governments need to increase public financing for the childcare sector and enhance income support for both center-based and domestic childcare workers. In some countries, childcare workers have actually been identified as a target group for income support channeled through cash transfer programs. In Thailand, for example, domestic workers can register for a government transfer of up to around $150 per month if their ability to work and earn an income has been affected by COVID. Finally, care workers' representation with employers and the state must also be guaranteed. This can be achieved through dialogue with care workers, unions, associations, to ensure their representation in decision-making around COVID response and recovery measures. In a really interesting example, in Ecuador, domestic worker unions worked alongside the Ministry of Labor, the National Council for Gender Equality, as well as the ILO and UN Women, to promote the creation of a cell phone app that informs workers about their rights during COVID. Governments must also work towards strengthening the right to collective action and collective bargaining in the childcare sector. As countries move out of the emergency response phase of the pandemic, they're of course going to face tough choices in dealing with the costs of recovery. And imposing austerity measures, to reduce debt is going to be an obvious temptation, but it would come at the cost, the enormous cost to health, education, and childcare systems that have proven so vital to our resilience and to progress on gender equality. Investing in childcare and care more broadly will facilitate a more inclusive recovery. Such investment can have a direct impact by boosting employment and job creation and retention in the childcare sector, while also alleviating the care constraints that keep women from working. It will require, of course, mobilizing public resources, private resources, and in low and middle income countries, foreign aid. However, most critically, it's going to require a shift towards recognizing the provision of affordable and quality childcare as a societal responsibility, as opposed to being women's responsibility alone.
Absolutely. Thank you. That is, that's absolutely vital. And I encourage you, I think the link to Kate's report has been put on the chat, so you feel free to go in and take a look at it more closely. So let me move to Sabrina. Sabrina, you had mentioned that affordable childcare for low-income women is a win-win-win situation, sort of triple bottom line type of scenario. So especially during the COVID context. So what promising approaches do you see and innovations that could be scaled up in this time?
It's totally a win-win-win. It's so apparent. Quality, affordable childcare is good for children, gives them the best start to life so that they can grow up and become smart, critically thinking, contributing members of society. It's great for mothers who are able to seek employment, stay in employment, and work with peace of mind. It's great for adolescent siblings, girls generally, who are relieved of child-rearing responsibilities and are able to attend school regularly. And the wins continue. It's great for employers who benefit from less absent workforce, a more productive workforce, as Rudaba and her team at IFC has shown. It's great for the economy when you've got 50% of your workforce able to work. It's a win-win-win-win-win. It really is a gift that keeps on giving. But in order for this to work, it means we need it to be available for the masses. And I just want to start off by saying that it's presumptuous to assume that everybody needs childcare. There are many mothers who choose not to work. There's many instances where you've got grandmothers or support systems, in which case the child is often better off in those areas. But as Carolyn said, that isn't always the reality. And last week, the World Bank released their new paper on childcare, and it said that there are 349 million children who need childcare but don't have access to it. And so how do we fill the gap for those children? I think that's the million-dollar question. As a service delivery provider, we've done a lot of thinking on this, and we know that no matter how big we grow, even if we do this work for hundreds of years, which is our plan, we will never reach every child. It's just impossible. And organizations like us, and there are such pioneers around the world who are doing similar work in different countries. We all are constrained by finances, so we definitely need more funding into this sector. It's one of our biggest constraints to be able to scale up. But we're cognizant that we are one part of the solution and not the whole solution. And on a very, very personal note, I'm 6 months pregnant right now with my first child, and I've been reflecting a lot. I've been reflecting a lot about this concept of it takes a village to raise a child, and I think the same sentiment applies here. It's going to take a village to solve this problem. And so when we think about this village, who's needed? It's the government. We need progressive, not punitive policies. We need financing, we need subsidies, especially for the lowest income populations who can't afford the full cost of quality care. And I think that quality element is super important, particularly when it comes to caregiver to child ratios. It's the private sector supporting family-friendly work environments, as I'm sure Rudaba will speak more to. It's researchers to provide the evidence of what works and what doesn't work. It's academia and colleges. We need accreditation for childcare workers so that it's seen as a profession and an honorable one at that. We need media. If communities and parents don't believe that children start learning until they reach the age of 3, which is what we hear in the communities we work in, then of course what happens in a childcare center doesn't actually matter. As long as you pick up your child and they're in the same form as when you drop them off at the beginning of the day, you're good to go. And we need a global media advocacy campaign to really shift the perceptions around the importance of the early years, why quality matters, what quality looks like, and how to make decisions on where to send your child. The village needs civil society, social enterprises who are entrenched in the communities and have these promising innovations to scale up. And of course, we need funders who can put up the capital to make this work, especially because right now what we're seeing is government and private sector, they might buy into the need for childcare. I think they're starting to get a lot of momentum, but they don't have the risk appetite to do so. And so can philanthropy come in to fund that shortfall right now until we can prove the case on how important this is? But I think the key is that we all need to talk to each other. And historically, we're not very good at this at all. So if researchers are answering research questions that don't push the policy forward or aren't relevant to policy decisions, we're not going to go anywhere. Or if governments create policies that don't reflect the realities on the ground, this isn't going to work. And if funders are funding their own priorities instead of what's needed for the sector, again, this isn't going anywhere. So unfortunately, I wish I had a silver bullet answer, but there is no silver bullet here. I think this is a super complex situation, but with concerted, collaborative effort, this village approach, I think we can get there. And now's the time. There's so much momentum around this childcare movement that we can start to capitalize on.
Thank you, Sabrina. And yes, I mean, I think we've got a village right here. We've got over 100 people participating and in this discussion. So hopefully we're all taking notes and listening to what the panelists are suggesting as potential pathways for promising solutions. And you mentioned the private sector and the role of the private sector. So I wanted to go back to Rudaba and ask her about the role of the private sector and what role are they playing, or could they continue to play in low and middle income countries? If you could maybe share with us some of the the promising private sector solutions? Yeah.
Great. And it is quite heartening to see that private sector companies in emerging markets particularly recognize the importance of this issue and have taken actions to address it, in addition to very real needs of surviving or sustaining their business. Yeah. So for many companies, this has been on top of mind. For example, in April, when IFC was the first DFI or a multilateral development bank to publish a guide on COVID-19 and childcare, one of our client companies in Pakistan, Artistic Milliners, is a denim manufacturing company, took the recommendations that we provided in that guide to heart, and they said, okay, we're going to do something about this. So the company had already, through our advice and support, set up a childcare facility for their low income blue collar workforce. Usually when companies set up childcare, it's for white collar, and the perception is that, okay, management is going to attend this daycare, children of management are going to use this. But this company said, no, we need our factory floor workers, our low-income workforce, our blue-collar workforce to be able to access this childcare facility. But of course, when COVID came, they had to close down the childcare facility to ensure the health and safety of their employees' children. But one of the recommendations was in our guide was to consider offering this infrastructure to children of essential workers. So this company said, okay, we're going to open up a childcare facility, follow standard operating procedures, make sure all the health safety guidelines are in place, and offer the service free of charge to children of nurses, doctors, policemen, and other essential workers in the city of Karachi. So we thought that was a great example of a company using their infrastructure, using their resources to help essential workers during the pandemic. In December 2019, we partnered with UN Women and produced a report titled Bridging the Gap, Emerging Private Sector Practices During COVID-19. We have a full chapter dedicated to family-friendly policies and practices. And these policies and practices we gathered through a survey of more than 80 companies around the world. And we have some very interesting examples, for example, from DBL Group in Bangladesh. They were able to they formed a COVID-19 committee for worker safety with a focus on pregnant and lactating mothers. And they used UNICEF's Rapid Pro app to provide working mothers with regular messages on maternity protection. An Armenian company, McCann Yerevan, initiated an individual one-on-one meetings with employees with children to review their schedules, provide them with flexible work schedules tailored to their needs, with full salary compensation. So it doesn't mean that you take flex work and you get paid less, but that was one of the actions that they took. IBM in Argentina, and several IT companies around the world, the technology companies around the world are offering extended paid leave in addition to their usual or normal paid leave allowance. They're offering even more to mothers and fathers, particularly in the wake of school closures and daycare closures. And I found one example very interesting of a bank in Italy that developed a Mama at Work program through which they are providing highly subsidized loans and financing solutions to meet to support new mothers to meet their care needs during COVID-19 and as they try to integrate work-life responsibilities. And lastly, I'm very excited that next week on March 16th, we are launching 2 reports. IFC's Tackling Childcare Initiative is launching 2 reports in Pakistan with support from Government of Canada. And one of the reports outlines the actions taken by 13 companies in Pakistan that joined a peer learning collaboration and made commitments to become more family-friendly employers. And it was thrilling to see that even during the pandemic, when many of these companies were facing severe business challenges, they were able to fulfill and advance more than 90% of their commitments and realize business benefits, such as higher employee retention and productivity during COVID-19. And examples of some of these commitments that these employers made as part of this IFC-led peer learning collaboration was, for example, one company for the first time in their 70-year history started offering paid paternity leave. And the best part is dads actually took it, thanks to a marketing campaign, some role modeling on behalf of management. And this is all happening during COVID-19. Some of these companies in Pakistan started offering training programs for new parents, as well as parent support groups for mothers and fathers to come together and share their challenges, ideas. One company realized that they did a childcare needs assessment, talked to their workforce, realized that a childcare center or a facility might not be the best solution for everyone. So they started offering a childcare allowance, and the employees are happy and the company is able to manage that as well. And then, of course, a lot of these companies during COVID-19 started offering flexible work arrangements, putting in place the technology and the support that parents need. And also, there has been a lot of emphasis on mental health in the workplace, particularly as working parents, particularly mothers, are facing a lot of stress and not enough time for self-care in the wake of all this an increase in unpaid care and housework. So companies I see more and more are also offering mental health support programs, bringing parents and women and leadership together in support groups to get through this together. And one thing that I want to end with is that we mentioned in our global guide for childcare and COVID-19, a guide for employers, where we highlight what actions employers can take to support family-friendly policies during this time. And one thing that we mention is that kindness, compassion, communication is key during this time. No matter what employers choose to do, how big they are, how small they are, if they can just keep compassion, kindness, and communication at the top of their mind when dealing with their employees, when interacting with working parents and mothers, that can already make a lot of difference. So just wanted to throw that out there as well.
Thanks, Rudaba. Those are that's just excellent words of wisdom there. Yeah, and some really interesting and very interesting kind of private sector solutions that seem to be working in various contexts. So thank you. Caroline, I wanted to finally just turn to you. Your research has generated some compelling evidence on the benefit of center-based childcare for poor working mothers in particular. So could you just give us a brief sort of summary about that, and could the model be scaled, do you think?
Sure, thanks. So as mentioned before, we wanted to see if providing access to affordable and improved quality childcare can help women improve their economic prospects by reducing their childcare burden. We conducted a randomized trial that had 3 arms. So mothers in 2 arms received vouchers for subsidized childcare that was center-based and covered a year. And then to examine whether the quality of daycare services affected women's use of daycare services. About half of the daycares participating in the voucher program were randomly selected to receive additional provider training and materials. We then assessed whether mothers use these daycare facilities, and if so, how it impacted their employment, the number of hours that they worked, and their income. So we found out that there was a high demand for childcare. About 80% of mothers who received the voucher actually did send their children to the daycare centers. Further, we found that even in our control group, that is women who did not receive a voucher, more than half, about 58%, sent their children to daycare. The demand for daycare is also reflected in the numbers of daycare facilities available. Sabrina had mentioned that there isn't a wide spread inventory of the existing daycare, but in our study we identified 48 well-established and registered daycare facilities. So what did we find? We find that women who received the voucher were 17% more likely to engage in paid work between baseline and endline. And this was particularly true for married women. And we think that this is because unmarried women already were working at the very beginning when we conducted our study. Women receiving the vouchers experienced a 24% increase in earnings, and that translates to about $6 a month, which can be quite substantial in our setting. And finally, we found that on average, there was no increase in the number of hours worked, which suggests that women were able to get better paying jobs. And in fact, we do see that it's those who are in those sort of jobs that demanded long hours that actually cut back. So we did a cost-benefit analysis that showed that the total benefits, that is the improved earnings, childcare cost savings, mother's free time, and other benefits that resulted from the subsidized childcare outweighed the cost, which was an average of about $90 per child per year. So this suggests that the provision of childcare may be a cost-effective solution to improve women's economic prospects when they're thinking of urban slum settings and other resource-limited settings. Now, can the model be scaled? Yes. I think given that our research shows that subsidized childcare is cost-effective, there may be ways in which that model can be scaled, and I suggest 2 avenues that may be relevant for many low and middle income countries such as Kenya. And Kate did mention that many governments in low and middle income countries already are implementing social protection programs that include cash transfers to vulnerable groups like orphans and older people, and providing cash transfers to women that are earmarked for childcare services. Using those existing platforms might be one way to scale up the model. Second, our research showed that a significant proportion of women, at least in Korogosho, where we did our research, were already paying for daycare. So it does mean there's a willingness to pay for the services. Now, in the healthcare sector in Kenya, we have initiatives like M-TIBA, which is a mobile phone-based service that allows people to set aside funds for healthcare. So the money that's stored in one's M-TIBA account can only be used to pay for services and medication at specific healthcare facilities. And I think a similar model could be tested for childcare in partnership with social entrepreneurs, mobile phone providers, government actors, all the people that Sabrina outlined when she was speaking, who need to be around the table. In scaling up, it is critical to ensure how quality childcare services are maintained. The concern about maintaining quality during scale-up is an aspect that the team, Kidogo and APHRC, are working on for the second phase of growth. I think to wrap up, I believe that providing affordable center-based childcare is an important strategy to improve the lives and welfare of women and children who are living in informal settlements in Africa and other resource-constrained settings. And I do believe that there are opportunities that we can leverage on to actually tackle the childcare crisis. So thank you.
Thank you, Caroline. Thank you so much. I have just a few recommendations to read out to you that came in from the chat before we get to some of the questions. So some of the specific recommendations, I'm just going to read them. One is initiating policies and actions that reduce unpaid care work, targeting boys and men for a positive masculinity, and governments to adopt affirmative actions for women affected by COVID-19 for recovery. So those are just some of the recommendations that came out from people in the chat. And there are also quite a few questions, which is fantastic. I've got a few here, so if you just let me read the first one here. So this is a question for all the panelists. It would be great if the panel could reflect on how we can push the quality childcare and reduction of unpaid care work burden agenda at the global level, particularly at the Generation Equality Forum. So maybe with that question, I will, I guess I can ask all of you, but let me start maybe with Kate. Did you want me to repeat the question, or you're good?
If you could repeat it once, that would be great.
Sure. Okay. So it says, it would be great if the panel could reflect on how we can push the quality childcare and reduction of unpaid care work burden agenda at the global level. So how do we push this agenda at the global level, and particularly at the Generation Equality Forum?
It's a wonderful question. It's a really key one. I won't speak specifically to the Gender Equality Forum, but more broadly speaking, something that we found in conducting the research for this report and for speaking with childcare experts, including Sabrina as well as colleagues at IFC and APHRC, was that the data that we have on the impacts of COVID and on the childcare crisis is so preliminary because we're only a year out. A lot of it's anecdotal. We need more production of research and data to demonstrate the impacts, but also the solutions. And something we were coming up against, and I saw this in the chat as well, was that there's far less research and data available for rural areas, for informal childcare providers. And so something that I would advocate for is for the sharing of best practices in data collection so that countries, including low and middle income countries, can get advice on the most cost-effective methodologies for collecting data on the childcare sector and for the production of research and evidence in these areas, because it's only through the production of this research and evidence that we can actually start to demonstrate the impact of different solutions the, I hate relying on it, but the economic case for investing in some of these solutions that we've been talking about, as well as the gender equality case, and inform actually, evidence-based policies and decision making. So I would say that increased data collection and research is a really key part of pushing this agenda at the global level.
Thanks, Kate. I might just ask Rudaba. I've got a couple of other questions that are specifically for Caroline and Sabrina. So maybe Rudaba, if you can, even from the international perspective, from IFC's perspective, what would you say would be the best way to push this agenda at the international level?
Yes, thank you for that question. And there's so many ways to do this. One of the ways in which IFC did this was to pull together a global working group. And Sabrina was part of it, Kidogo was part of it, IDRC was part of it. We pulled together a global working group of more than 30 organizations, including UNICEF, LEGO, Goldman Sachs, OECD, ILO, you name it. All the brains in this care space, we pulled them together, and we looped in their expertise and developed a global guide for what employers can do to support the care needs of their employees, including through family-friendly policies and practices. Because when we were doing this work, employers used to come to us and say, look, we make socks, so we don't really know about care. What do you want us to do? So really, sometimes they understand the business case, but they don't necessarily know what or how they can put some of this into practice, particularly for smaller companies that don't have access to a lot of financing in this regard. So then we've developed this guide with the expertise of these more than 30 organizations. And that guide has since then been referenced in so many different publications, blogs, has been utilized by companies and private sector employers, as well as public sector partners as well. So that's just one way. I think IFC realizes that we have this convening power of getting people together, establishing networks, establishing communities of practice and working groups. So that is one way. And then the other way is that when we work with companies, and I mentioned this peer learning collaboration in Pakistan with 13 companies, one of the commitments that these companies made was to talk about the importance of care and childcare. What is the business case for childcare? Why is it important for the business? Why is it important for employees at any international platform they could think of? So we had CEOs of these 13 companies going and talking about giving interviews and being on panels. So when it comes from another CEO or another private sector employer, other companies are more likely to hear it rather than me talking about it or maybe an NGO talking about it. So we really, I think, pushed our companies, our partner companies, to go ahead and talk about this at any international, national, regional forum conference that they could think of.
Fantastic. Yeah, that is a really good advice, and sharing these success stories. I mean, they're so impactful, and it gives people hope. I mean, whether you are even just a small organization, if you realize that the overall wellness of your employees will impact your bottom line, then it's in your interest to invest in improving the overall wellness. So that's wonderful. Let me get to the second question, and this is specifically for Caroline and Sabrina. The problems you described have long existed with little government action. Do you think the political will is there for government, not just philanthropic, but for government investment, not just philanthropic investment? I guess that's the question. So Caroline, can I start with you?
Sure. I do think that the government is quite interested and invested in what I'll call early childcare and early childcare development. When we were doing our research, we did reach out to the Nairobi City County. In Kenya, early childhood development is actually devolved to counties, so it doesn't sit with the national government. And they actually were quite excited to be part of our project. And they did mention one of the challenges that they face is, yes, there are these national guidelines for what a quality childcare facility should look like. But they know that many daycares in informal settings would not meet those standards. And they were quite excited to engage with us to learn about how our research can inform their own implementation. How do they support daycares? And even when we were undertaking our study, it was people from government who were working with us to routinely monitor the activities that were going on at daycare level. And in all our conversations with them, they've actually been quite open to collaborating with us and other actors in the early childcare sector to strengthen childcare support.
Thank you. And Sabrina?
Yeah, just I guess just briefly on the global question, I think it's Kate and Rudaba hit the nail on the head that there is such importance of coordinating efforts, but let's not forget the importance of the bottom-up grassroots approach, because we don't want frameworks and policy documents to sit somewhere and it doesn't actually trickle down to the women and families that need the support the most. On governments, I would say yes and no. There's definitely more of an appetite to supporting childcare now, but I don't think it's coming from COVID. I think it's coming because there's elections in Kenya next year. And I think that's the sad reality. We've been talking for years to county governments on the importance of this issue. And I think one of the biggest problems or impediments is, again, this notion that early childhood development in Kenya, at least, is seen as pre-primary, age 4 and above. And when you talk to government officials, no matter who they are, and ask them, like, what is supposed to happen to the 0 to 3-year-olds, the large answer you receive is they should be at home with their moms. And it fails to acknowledge the reality that moms work. And so I think, again, there is a need for showcasing the reality on the ground. But I think there is some more momentum coming from counties like Nairobi, as Carolyn mentioned. Other urban counties will be setting up model childcare centers with 3 counties in a public-private partnership this year, which we're excited about. And so there is a lot more momentum. But again, these are 3 out of 47 counties in Kenya. And to the questions that have been raised, there isn't a lot of support for rural or peri-urban areas, again, I think because governments don't acknowledge the reality of working moms no matter where they are in the country. So yes and no, but let's work with what we have.
Yeah, no, absolutely.
Erin,
yeah.
I just wanted to quickly mention an example in Jordan where the National Council for Labor actually has a program where they work with the private sector companies to set up operations as well as daycare facilities in rural areas. So again, it's an interesting example of a public-private partnership where the government is has this program of incentives to work with the companies to help them set up operations. And we work with one such company in Jordan, and I actually visited the childcare facility and the factory in a rural area. And it was such a heartening story because with support from the government, the company was able to expand into this rural area and set up this childcare facility. And women did not want to use it. When they first interviewed women said, no, we would much rather get a subsidy and just give us 25 Jordanian dinars per month and we'd be happy. But the company went ahead and piloted a small childcare center because there's also a legal requirement in Jordan that mandates employers to provide or support childcare. Mm-hmm. So the company had to move forward and set up a childcare facility. And then through word of mouth, when women saw how their children were benefiting from being in that daycare setting, how safe they were, there was an on-site doctor, nurse, there were breastfeeding locations, there was early learning and playtime and meals. So word of mouth spread like wildfire, and then from not many women wanting to use the childcare facility, there's actually a wait list. So the company is now talking to the government and to investors to see how they can expand the childcare facility to accommodate 50 more children. And for many of these women, this was their first job, paid employment. Women work, it's just that it's unpaid. So for many of these women, this was their first paid employment and a first time they were considering childcare. Just I wanted to share a story that there could be a program like this where the government partners with the company to set up operations and facilities, ensuring quality even in a rural setting.
Yeah, and I mean, that's fascinating, especially since the majority of the poorest are in rural settings, right? So finding opportunities and solutions that are effective in those settings is absolutely fantastic. Hopefully, we can read more about it. I don't know if there's going to be a link that's shared, but that is really, really good and very encouraging. So I have, I think I have one more, well, I've got a few more questions, but we don't have a lot of time. So let me just get you this, this next one, which is a combination of a couple of questions that came in on the chat. In countries, and I think this is open to everyone, so all the panelists, just to open your ears. So in countries where appetite to invest in early childhood development is limited, how do you see your recommendations implemented in such countries? What do we have to do differently? What could be the impetus or the imperative for governments to take up these recommendations? This points to a broader question on how we can move the needle on gender equality. I think it also, you know, I think Sabrina was talking about, you know, it's about norms also. I mean, even if early childhood development centers are there, but women don't want to send their children there, or if the overall societal idea is that children should be kept at home, I mean, these are areas to look into as well. So what actions are needed to achieve impact at scale? Anyone? You can just jump in. Is it too much question?
Well, maybe I can just share my quick thoughts. I think the point that was made about business case is critical, and I think it's not just for the private sector, but also for government. What do you lose by not investing in childcare for the women in the economy, and what you gain when you actually do? Something else that maybe I could highlight in our conversation with civil society organizations and governmental agencies that are involved in others, in our case, sexual and reproductive health work, is the importance of hearing the voices of women in many of these forums. And I think Kate had talked about the need for best practices in research. And one thing that people have consistently come to us about is about participatory research, where women and men who experience challenges with childcare actually voice their concerns and share their lived experiences in some of these forums. Because I think it's true, governments, even in Kenya, yes, the elections play a key role, but if they can hear what their constituents are saying about how the lack of childcare affects them, then they may respond. Thanks.
Great. Thanks, Caroline. Does anybody else want to come in?
Yeah, I can piggyback off of Carolyn. Thanks for getting us started as we were thinking. I think a couple of impediments, and again, no solutions here, but just to add to the conversation, I think one of the biggest impediments is there's a short-term thinking amongst policymakers. You're going election cycle to election cycle. And I think the benefits of childcare, all of the things that we talked about, this win-win-win, you don't see those benefits for years, decades often. And government officials don't think in that way. They think in 3 to 4 year cycles. And I think that's one of our biggest issues, is how do we shift the perception around the long-term benefits, or are there short-term wins that we can be looking at that could incentivize governments to prioritize this? And I think in terms of elections, that we're really excited to make childcare an election issue. If constituents are demanding it, the hope is that governments will listen. And so how can we again rally communities, mothers around this importance of quality, accessible childcare? I think the other issue is that there's not enough females in leadership. And I think this is the government, it's the private sector as well. We've just noticed that the communities where we thrive the best is when there are female leadership in the community health volunteers, or the the chiefs in that community, our programs take off like this. And our hypothesis, and I'd be curious if Rudaba feels the same, is that female CEOs already are bought in many cases on the importance and are ready to go. And so the more that we can get females into leadership positions at community levels, at county levels, at national levels of government, I think the faster we'll see this issue take off.
Good. Okay, I've got one more question for you, for all of you. So would you say that childcare is a silver bullet to addressing unpaid care? Can I start with Rudaba?
Oh no, I have to kick this off. I don't think so. To be very clear and honest and candid, even in the work that IFC does, we always say that childcare just on its own might not have the impact, for example, in the workplace, if it's not accompanied by, let's say, paid leave, maternity protections, breastfeeding support, safe transportation for mothers and children to, especially if they live far away from the work site and there's on-site childcare. How do we bring, so the flexible work arrangements, support and role modeling from senior leadership, more women in leadership, as Sabrina mentioned, yes, more women at all levels of the organization. So that's why we say to companies that look at childcare and family-friendly policies as part of an overall diversity and inclusion and business growth strategy. So when you consider it in that holistic way, then it's just one of the tools you have to create an environment that is overall family-friendly and women-friendly and kids-friendly and then sustainable business environment, right? So I would say that it has to be part of an ecosystem. It has to be part of a multi-stakeholder initiative. It's a business imperative. Family, of course, families need it, but it's business, an economic imperative, and all actors, all hands on deck for this.
Yeah, thank you. Kate?
No, I don't think that childcare is a silver bullet. And in fact, in the paper, we explicitly state that it is not a silver bullet in tackling women's disproportionate and growing burden of unpaid care. And in fact, we acknowledge that it may not even be the most important challenge that women are facing in some contexts. Other dimensions of unpaid care, whether it's elder care, domestic work writ large, or caring for the sick or disabled individuals, are also really critical and important parts of the conversation around COVID-19 response and recovery efforts. They just were, however, not the focus of our report specifically.
Thanks. Caroline or Sabrina? Is it a silver bullet?
Yeah, I definitely don't need to repeat what Rudaba and Kate said, but completely agree. And I run a childcare network, and that is our solution. And it's still in cases where childcare is not necessary because women are at home and choose to be at home, or where grandmothers are available, you still see the burden of unpaid care work fall disproportionately on women and girls. So absolutely, it's part of the solution, but not the whole solution. And I think it varies depending on context as well.
Absolutely. Caroline, you want to have the last word?
Well, I would just echo what the others have said. No, I don't think that it is a magic solution. I think it's part of the solution and an important part of the solution. I think there are many other factors that limit women's full participation in the labor market, if that's in our case, which is what we were looking at. And those things need to be addressed as well. I think Kate had mentioned about if women don't have access to water supplies, if they have to walk around looking for fuel, there are other demands on their time that limit their full engagement or economic prospects. And I think all those have to be looked at. But childcare is an important part of that solution. Thanks.
Lovely. Well, thank you, ladies. Thank you so much for your insights and all the research and the work that you've done on this particular issue and continue to do in all your various avenues and paths to try and bring insight and leadership in this particular discussion, which I think, as we said at the beginning and we've said throughout, is just one of the, it may not be the silver bullet, but it certainly is a massive piece of solving one of the biggest burdens on women's time and women's ability to be, you know, real agents of change in their own communities and economic players in their economies and in their societies. And I'm sure we'll continue with this debate as we go further, and hopefully with the 100 or so people that are on this call today, that the insights that you've given us will trickle down into their discussions at the various levels, whether it's with NGOs, with policymakers, other researchers, because I do think that, you know, doing this kind of research as well is not, maybe not, it's not a simple and easy thing to do. It takes a lot of finesse and a lot of skill. So I would recommend to the researchers that are out there today to reach out to some of these panelists for you know, advice and tips on how best to do this, the research in this area of childcare, and because I think they've probably learned a lot. I know Kate, I was on a discussion with her recently, and I just know that there's just been so much that she has learned in terms of, you know, how do we ask these questions and document, and then what do we do with this data, right? What do we do with this data, and how can we amplify its impact for good? So now, yes, we've come to the end, but I want to bring in Cheryl Urban from Global Affairs Canada. I mentioned Cheryl at the beginning. She's the Director General of Economic Development and International Finance Institutions. I think she's based here in Ottawa. So she's going to give us some closing remarks and tell us about how the issue of paid and unpaid care, unpaid care work is integrated into Canada's Feminist International Assistance Policy. So I'm just going to make sure that she is, oh, there she is. So welcome, Cheryl. Over to you.
Thanks very much. You can hear me?
Yeah.
Okay, wonderful. So thanks, Erin. Merci beaucoup pour cette
Thanks very much for this invitation to participate in this event. This was a great panel, a wonderful discussion, very compelling evidence shared today, and this brings us together. We need to talk to each other. The compelling evidence shared today shows us how important issues of care, especially childcare delivery, are important for gender equality and post-pandemic economic recovery. It is clear that the disproportionate and growing responsibility for the care of women and girls limits their ability to participate not only in the labor market, but also in education and public life.
Data showing how time spent by women and adolescent girls on unpaid care has skyrocketed, keeping them out of work and away from studying, yet only 8% of global economic responses to the pandemic have addressed unpaid care issues. But this discussion today has also demonstrated that there are so many opportunities for us to work together to challenge the status quo on this issue. The evidence provided today on different approaches to the provision of childcare globally, whether in South Asia or in informal settlements in Kenya, demonstrates the opportunities for effective government and private sector investment to support positive outcomes for women's employment, children's development, and household well-being. So on Canada's response, care issues were already a priority for Canada before COVID-19 struck. Our Feminist International Assistance Policy explicitly calls out the need to address inequalities with respect to unpaid care work, particularly within the context of meeting inclusive growth goals. More recently, in 2019, our Minister for International Development's mandate letter included a reference to addressing the rights of both unpaid and paid care workers. And in January, a supplementary mandate letter reinforced the care priority within the context of COVID-19. And at Global Affairs Canada, we know that moving the needle on this is something that we have to prioritize, and we are fully engaged. We recognize that the pandemic offers a crucial opportunity to rethink how childcare in particular is managed within our households, our economies, and our societies. For this reason, Global Affairs Canada is ramping up its efforts on care in multiple ways. Partout où nous le pouvons, dans les forums mondiaux, le Canada profite.
Wherever we can, in global forums, Canada is taking the opportunity to emphasize the importance of caregiving as countries work on their economic recovery plans. We take a feminist and human rights-based approach to ensure that our programs recognize the value of paid and unpaid caregiving work, and we actively work to reduce and redistribute unpaid care responsibilities. We're also making efforts to address the rights and needs of paid caregivers and to ensure that their voices are represented. We're also working to create and share the evidence to better understand the approaches that work in caregiving. We want to ensure that their voices are represented. I would like to recognize the crucial work of IDCR and its partners in this regard. We are also very proud to support the work of the International Finance Corporation to advance the issue of employers-funded childcare.
Some transformative programming on care. For example, several projects, including with partners Plan and Oxfam, do hugely important work to engage men and boys on sharing unpaid care work more equitably within the household. In terms of childcare provision, we've worked with Trademark East Africa to promote the economic empowerment of women traders, including through the provision of childcare facilities in urban and border markets, such as Busia on the Kenya-Uganda border. At the policy level, we're partnering with the World Bank through the Mashreq Gender Facility in moving the childcare agenda forward in Lebanon, Iraq, and Jordan by supporting the development of national action plans and legislation that removes discrimination against women in the workforce. I'd like to close with a call to action. The pandemic has brought us to a paradoxical place where care has perhaps never before seemed so crucial. Yet those providing it, both within and outside the household, are increasingly vulnerable and in need of our care. Investing in care as part of recovery plans has the potential to spur sustainable economies, restore and create jobs, close the gender gap in labor force participation, and contribute to more resilient societies and economies. Erin said that the success stories give us hope. As a global community, we can transform the childcare landscape as well as the care economy more broadly by building alliances of people advocating and working for change. Now is the time to harness the substantial international attention that the pandemic has placed on care. Everywhere in the world, from the rich north to the global south, from the most vulnerable to those in positions of privilege, the importance of care is now better understood. As a result, public support towards this issue is starting to build. Given that the most vulnerable are those most affected by lack of access to affordable quality care worldwide, it is incumbent on those of us with a voice to move this agenda forward. This International Women's Day, let's commit to ensuring that building back better is feminist, considers care issues, and moves us forward together. On this positive note, I'll leave you today, and thank you so much for the opportunity. Merci beaucoup.
Thank you so much, Cheryl.
Thanks a lot.
I got goosebumps. So thank you for that, and thank you to everyone in the audience for spending this time with us, and thank you again to our panelists, to our event organizers, and to everybody behind the scenes that took part in this event. And I would love to just wish you a happy Women's Day once again. For those of you who have a little bit left of it, others have a full day still. And I look forward to staying in touch with you and keeping this active community, this village together, so we can speak with an even stronger voice and make a difference. Thanks very much.